Okay. All right. We still have 3 more minutes. So relax. Did anyone not get the assignment from Monday? Seems like there were maybe a few. Danny, I know I gave it to you. So. Is there any questions in particular? Some maybe that you especially were struggling with? So it was just activities 15 and 17. Okay. Would it be okay if I asked you to turn it in at this point? Run? Okay. I will give it back because it's a good study tool for the exam, so I'll just make sure your name is on it. That way I can put some points in the grade book. Would be the lentil axial, and so that's a trochoid or pivot type joint, which would be transverse plane from the anatomical position. So C1 to C2, this trochoid or pivot would be the trochoid or pivot. Now we'll come back in a second.
Yeah.
Do you have your assignment already? That's a nice picture.
Thank you.
Like that one. Need a little more time?
Yes, it's a deep joint, but
Has to do with the design of the joint, so it's like a kind of like a ball fitting within say a notch. So we have another example of where the proximal range. So C1 to C2, the connection is most similar to trochoid. And then the other one that refers to the facets, more spine, C2 to C7. Rotation happens, rotation does happen in the ankle region. So the true ankle joint is the hinge. And then you have joints below that, the navel, inversion and conversion. There's a hinge. Yeah, so everyone, the ankle is a hinge joint. So we can invert and evert, but that's below the true ankle joint. The hip can do all 3. Oh, the knee just one.
so it's usual as well. Like explains the word some more complex. But we
Just the knee is not a pure hinge joint, but it's mostly a hinge joint.
okay. So it's just you want us to know it's
Just a hinge. Just one. But we'll talk about how that is not, for the knee joint in particular, it's not completely true because there's a little bit of rotation.
that's what I'm getting at.
Okay, so let's have a little bit of review. So let's talk about joint actions. Joint actions. So if I'm in the anatomical position and I do this with my shoulder joint, what would that joint action be? Okay, so I'm in this. Yes, flexion. So what's the opposite of flexion then?
Extension.
Extension. So what plane is that?
Sagittal.
Sagittal. Okay, so what if I did this? So if I'm here and I go up here, what's that known as?
Abduction.
Abduction. And then the opposite, coming back down, would be adduction. So the shoulder, what if I'm here and I do this? Say it loud.
Horizontal abduction?
Yes, horizontal abduction. So what if I'm here and then I do this? Horizontal adduction. Okay, so what if I'm at the shoulder and I'm doing this? External and internal. Okay. So what I'm handing out next to you is going to be very important because it's important that we eventually make the jump between anatomical position and what actually happens in practice. So what does horizontal abduction actually look like? 1, 2, 3, 4, 5. 4. 1, 2, 3, 4, 6. So in practice, what do all these joint actions actually look like? Because from the anatomical position, things are almost never nice and neat. Everything in position, okay, that was horizontal adduction, this was horizontal abduction. So we don't really move like that. So in practice, it's important we make that jump. So knowing the difference between flexion and extension, what that actually looks like. Abduction, adduction, horizontal abduction, adduction, internal and external rotation, plantar flexion, dorsiflexion, radial deviation, ulnar deviation, all of those things. So this is a handout that I made from your textbook. So we're going to go with this textbook in terms of muscles and that promote joint actions. So what you have here on the first page is corresponding movements of the shoulder joint and scapula. So we talked a little bit about scapulohumeral rhythm and how if the shoulder joint is doing one thing, then the scapula has to rotate or adjust in some way to allow the shoulder joint to move optimally. So it's coordinated actions of the shoulder joint and shoulder girdle, but most of the action at the shoulder girdle takes place at the scapula. So we call that the scapulothoracic joint. So I want you to take a look. So if the shoulder joint is abducting, so just follow along with your table there, looking across the row, what should the scapula be doing? Yeah, so it's got an upward rotation to it. So in the same way, if our shoulder joint is horizontally abducting, what's the scapula doing? Just look at your table. That's what it's for. Yeah, retraction. So really easy. So you just if you can identify the big action at the shoulder, then you can identify the smaller action at the scapula. And that scapular action is really important because that allows the shoulder joint to get the best range of motion or the most range of motion. Because if the scapula didn't move, then the shoulder joint would have a hard time reaching its full range of motion. So, and think about it. What does retraction actually mean? What do you think about when you think of retraction? The scapula moving in what direction? Yeah, towards the midline, we could say towards the spine, right? So if I take my arm and you can and do that, and if I really go back as far as I can you feel what the shoulder blade can you feel what the scapula is doing? It's moving, isn't it? It's moving in towards the spine. So we call that scapular adduction or scapular retraction. So in the same way, if I'm doing this and I move it around like this, can you kind of sense what the scapula is doing? It's moving in the opposite. So you can look across there. That was horizontal adduction, right? Okay, horizontal adduction, which means the scapula is, you look across and you see nice and neat, adduction or protraction. Okay. So moving on to page 2, we go through each of your joints, proximal to distal, just like the textbook. Chapter 4 is all about the shoulder girdle. Chapter 5 is all about the shoulder joint. Chapter 6, elbow, radial ulnar joints. Chapter 7, wrist and hand. And then the second half goes through the lower body. In the very end, we pick up with trunk and spinal column. So for the movements of the scapula, you have the muscles listed. So this is a very convenient resource because you don't have to find where that is listed in your textbook. So I've already done that for you. So for example, so we talked about retraction. So retraction is also known as adduction of the scapula or retraction. So the muscles are listed there for you: trapezius fibers, lower and middle, as well as the rhomboids would be involved with that. Okay, so then you can look at the shoulder joint. Look at the shoulder joint. Remember we talked about how mobile the shoulder joint is? So you have all these actions at the shoulder joint. And so for each of these actions, you have a list of muscles. So maybe some other textbooks will vary a little bit in what muscles are listed. So I wanted to make sure we were consistent because we're using the Floyd textbook. So for example, we talked about horizontal adduction. So going from here towards the midline. So you go to the very bottom there and you see that the muscles listed for horizontal adduction would be the pectoralis major upper fibers, the pectoralis major lower fibers. Okay, so how many of you knew that the pectoralis major has really two sections? They're both innervated by a different branch of a nerve that we'll get to in chapter 5. Coracobrachialis and then deltoid anterior fibers. Okay. So does everybody understand how this reference guide works? Okay, so the very next step, so we will get back into the end of chapter 1 and then start chapter 2, but I want to bridge that gap between anatomical actions, nice, neat anatomical position, versus what you actually experience in practice. So this will serve as a good warm-up. We'll do several of these movement analyses. And it's a good way to learn the practical application. Okay. The other thing about just learning isolated joint actions is that most of the time we have multiple joints working together. So this will help you learn how to identify that. So we'll do several of these movement analyses, and it's a good warm-up activity, and we'll keep coming back to this because it's the study of movement. So we want to be able to accurately identify joint actions, muscle actions, prime movers, planes, and axes. So let's go through a little bit of an introduction here. Today we'll do this one together. So you can read through the top paragraph there with me. On the following pages, please describe the movements at the joints given in terms of joint actions, type of muscle action, concentric or eccentric, so I'll explain what that means in a moment, and the muscles producing the movement and the planes and axes of movement. You may work in groups or individually on this assignment. Make sure to write your name at the top. Use your movement and muscle sheet. So you'll notice that there's a certain number of blanks. These blanks, for example, for the shoulder joint, there's 4 muscles listed. That will correspond exactly to your movement and muscles handout if you choose the correct joint action. So what you're being asked, if you look under those pictures, so you're looking at a seated cable row. So how many of you, by the show of hands, have done? Okay, all right, so all of you pretty much have seen it or have done it several times. So underneath there, please describe this movement from the picture on the left to the picture on the right in terms of joint actions, type of muscle actions, and the muscles producing the movement, and the planes and axes of movement. So that seems like a lot, but it's really not as difficult if you know how to use your movement and muscles handout. Okay, so we're pretty much analyzing the first part. So let's talk about what muscle actions we have. The way that muscles are producing force. So you have 2 choices in this case. It can be eccentric or concentric. So think of it this way for right now. Concentric means you're lifting something. Eccentric means you're lowering something. So very simple. So Ashley's heard all this before. If you have biomechanics in the spring, we review it again. So in this case, going from the picture on the left to the picture on the right is the weight. So it'd be a plate stack. Is the weight being lifted or lowered from the picture on the left to the picture on the right? It's being lifted, right? So it's only the first half of the movement, right? So going from the starting position on the left to the midpoint on the right, the weight is being lifted. So you would see the stack of plates. What direction would they go? They would go up. Okay, so the weight's being lifted. So if the weight's being lifted, the muscle action is concentric. Concentric. So you can't have concentric in one muscle and eccentric in another muscle. So if you have a group of muscles that are performing a movement, it's going to be all concentric or all eccentric. So in this case, we have the scapula, the shoulder joint, and the elbow joint that are working together to do this movement. So it's going to be concentric, 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 all the way down. So first thing we identify, is the weight being lifted or is the weight being lowered? So just
muscle action.
That's the muscle action. So in this case, for the first half, anyway, which is all that you're being asked, is the weight's being lifted. So it's concentric. Now if I asked you, okay, I want you to analyze from the picture on the right back to the picture on the left, what would you tell me? Yeah, the weight's being lowered. The stack of plates would come back down. So the weight's being lowered. the weight's being lowered, it is eccentric. Eccentric. So that's really what lifting weights is all about. We do positive work when we lift something. We do negative work when we lower something. Okay, so first half, we lift it, that's concentric all the way down. Okay, so the next question, what is the joint action at the shoulder? So why is it that I would skip over the scapula and go right to the shoulder? Because, especially when you're first learning this, it's a lot easier to identify what the shoulder joint is doing, and then you can use your packet as a reference to look at what the scapula is doing. So, we're looking at the shoulder joint. Now this can be really difficult because you have not only the shoulder, but what other joint is also working? The elbow. The shoulder joint and the elbow are working together. And more often than not, that's the case. You have muscles that act on the shoulder joint, and you have muscles that act on the elbow joint. Okay? So coordinated joint actions, multiple joints working together with different muscles controlling the action of both joints. So your nervous system is the ultimate multitasker, able to coordinate the action of multiple muscle groups at the same time to produce efficient movement. Okay, so simply put, let's look at just the shoulder joint. So what segment of the body does the shoulder joint control? It's pretty much all the way from here down to the elbow joint, right? So show me the starting position. So he's starting here, and all I want you to do, I want you to forget about everything from just above the elbow down. Forget about everything from here to here. So all we're worried about is from just above the elbow to right here, this little segment right here. So we're starting in this position, and where do we end up? In this position. Are the elbows out here? Elbows are in here. So let me ask you a question. If he's in here nice and tight, what plane would that be? What plane describes forwards and backwards movement? Sagittal. Okay, so that's another clue. We can go ahead and fill that in because it does ask you for that. So across on the shoulder joint line, it asks you to write in the plane. So you would write in sagittal plane. And what's the associated axis for the sagittal plane? Frontal axis. So sagittal plane, frontal axis. Forwards and backwards movement. Okay, all right. So we're starting here and we're pulling back into the body like that. So any guesses? It is extension. Hang on to that thought though. It is extension. Okay, so let's take a step back. What does extension look like in this nice, neat anatomical position? My arms are up here somewhere, maybe up here, 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 but what am I doing with extension? I'm doing that, all right? Yeah, I can be way up here when I start, and I can extend. I can be here when I start, and I extend, but I'm extending the shoulder joint. Okay. So from the picture on the right to the picture on the left, we have extension of the shoulder joint, extension of the shoulder joint as the weight is being lifted. Okay. So based on your movement and muscle guide, if we have extension at the shoulder joint, what do we have going on at the scapula? Page 1. Page 1 of your movement and muscle guide. If we have extension at the shoulder, what is the corresponding action at the scapula? Two things. The depression and downward rotation. So you notice how many blanks do you have underneath the scapula? 2. So you would then write depression. And on the next line, you would write downward rotation. Everybody with me? Yes.
I have a question. So, I was thinking this is extension for your shoulder joint, but then you're pulling back in.
Mm-hmm.
to
So
me,
then I
that
guess
becomes
what's the opposite of extension?
Flexion.
Mm-hmm. So what is flexion then? Show me flexion. So anatomical position, if I'm here and I want to flex the shoulder joint, what do I do? Right? Flexion. And then if I want to extend, what do I do? Like that. Flexion, extension. So sagittal plane. So does everybody understand where I got extension from? And then how we were able to know that it's depression and downward rotation. Okay, so if we have that, the only joint action left would be what? Elbow, okay? So what does the elbow do? Let's go back to our basic anatomical position. So the elbow joint is what type of joint? It's a hinge joint. You can remember ginglymus if you like ginglymus. I kind of like to say that word. Okay, so what does the elbow do? Yeah. So I can flex and I can do what? And I can extend. So what is the elbow doing from the picture on the left to the picture on the right? Yeah, and it's flexing. So I have complementary extension of the shoulder with flexion of the elbow. So can you see how that works? You've got 2 different joints that work together, but they have different muscles that control each of them. So we start in this position with the elbow extended, and then we end in this position where the elbow is flexed, right? So it's elbow flexion. Okay, so you would then write flexion as the joint action. Okay, so you have any questions at this point? Is everything making sense? It's hard to make that jump from the nice, neat anatomical position to what you actually see in a practical setting. Okay, so we need to get some muscles. So we've got all of our muscle actions. It's lifting. So muscles. Let's look at it. So scapula. So that'd be page 2. So we have, what are the 2 muscles for depression? Lower trapezius. What are the 2 muscles for downward rotation? Pectoralis and rhomboids. So how many muscles do we have? There's 3. Okay, the pectoralis minor is common to depression and downward rotation. So how many blanks do you have there on your analysis? 3. So in the muscles, okay, so is everybody on page 2? Everybody on page 2 here? So you would write pectoralis major. You can write lower fibers, trapezius. And then you can write rhomboids. So pec minor, rhomboids, lower trapezius in those 3 blanks. Okay, so is everybody with me? Okay, so then what do we got to do? We got to go to page 3 because we need to know what muscles control extension. So how many are there? There's 4. How many blanks are there? 4. So you would just write in an extensor, the pec major lower fibers, deltoid posterior fibers, latissimus dorsi, and teres major are the extensors of the shoulder. Does that mean that all four of those are equally involved? Nope, it doesn't. So that's why we have things like electromyography that we can use to identify which muscle of those four might be most emphasized. So, in other words, do we always do this exercise the same way? No, that's the beauty of exercise, is we can change it. And if we change it, we still might have the same muscles involved, but they could be emphasized in different ways. So we can change our grip in some way so that one muscle might be emphasized over the others. So electromyography helps us do that. So that's a fun tool to use. Okay, so where are we? We need our elbows. Elbow. The three muscles of the elbow. I like to call them 3Bs. So you can turn the page to page 4, and you can see the 3Bs of elbow flexion. 3Bs of elbow flexion. So biceps brachii, brachioradialis, and brachialis. Okay, so those are the three muscles that flex the elbow joint. So that's number 1. Do you have any questions? Okay, all right, so we got just a couple more on this today. Okay, so number 2, barbell bench press. And I'm asking you just the shoulder and the elbow. Just the shoulder and elbow on this one, so you don't need to identify what the scapula might be doing, and it's actually isometric. Isometric is the muscle action I didn't tell you about. We'll get into that in chapter 2. For now, the only thing that exists is concentric and eccentric. So, asking you from the picture on the left to the picture on the right. Okay, so the first question, is the weight being lifted or lowered from the picture on the left to the picture on the right? Lifted, which means what for muscle action? It's concentric, so you would then write in concentric in both those spaces. So I gave you the second half of the movement on purpose in this handout. So we haven't got to eccentric yet. That's the next step. We'll just do concentric for now. So concentric. Okay, so shoulder joint. So, okay, all right, so you need to look at what is this action mostly, okay, because generally on a bench press we say you want to tuck your elbows a little bit to protect your shoulders, okay, so if I was doing a bench press standing up, okay, so I imagine I'm not lying down anymore, I'm standing up, what would I do? I'm looking at this same segment. I'm going from here, where, to here, right? Here to here. Here to here. What's my shoulder joint doing?
Horizontal adduction.
Yes. Very good. Very good. It is horizontal adduction. Mostly. It's not perfect because we don't flare our elbows on a bench press, but it's mostly horizontal adduction. So what if I was doing a close grip bench press? So imagine I go from just imagine I'm not laying down, but I'm in a standing position. What would that look like? I'd be here, and then what would I do? I would go here. So what's my shoulder doing then with a close grip bench press? It is flexion in that case. It is flexion in that case. Now, the other thing you need to understand is that when we go from a nice, neat anatomical position to a supine position, which is lying face up. That's a supine position. Just like if my palms are up, I call that, what do I call that? Supinated. So the body as a whole can be in a supine position if I'm lying face up. The planes move with the body. So if horizontal adduction is in what plane? Standing up. This is sagittal. It'd be transverse. It's also transverse when I lay back, because the planes move with the body. So just imagine doing a movement in the standing position and then tilt everything back to where you're doing the same thing in a supine position. So it's still transverse plane. So horizontal adduction, transverse plane at the shoulder. What's the axis for the transverse plane?
Vertical.
Vertical, sometimes called longitudinal, your preference, which term you like. Okay, so elbow. So the elbow is bent, and then I get to the top, and what happened? It extended, so it's elbow extension is right, elbow extension. So all we really need to do at this point is identify muscles. So I would then you could look at page 3 for muscles of the shoulder joint. So horizontal adduction would be, you have 4. Pec major upper, pec major lower, coracobrachialis, deltoid, anterior fibers. So again, that doesn't imply that those 4 each contribute 25% to make up 100% of the movement. The emphasis can be, there can be one part that carries the majority of load depending on a number of factors. So you go over to page 4, and what's your elbow extensor? Triceps is the major one. You have a little tiny muscle. It's more of a stabilizer of the elbow. I wrote that in there already. It's called the anconeus. But for dynamic extension, it's just the triceps. There. So then you would write in triceps. Okay, so big moment. I'm going to turn you loose and ask you to do this very last one on your own. And so I encourage you, work with a partner, group of 2 or 3 of you, communicate. I'll just be walking around, and I'll check back in about 5 minutes. Okay? Go ahead and try to do that last one on your own.
If it was just
Seeing
abduction,
some
it
arms
would
out.
be-
The way.
this would be horizontal. Especially abduction. Yeah, you're right. Because I think normal abduction would just be like,
Where you're sitting right now.
that if we're starting here.
Yeah, shoulder.
Yeah,
That's what that example
yeah.
was.
Horizontal.
Dang, that's come from.
I know.
All that matters is
Remember
this
that.
right here. So you're going from this position to this position. What are you doing when you press the barbell up on the bench press?
And then abduction would be like bring it back.
Yeah.
How is that different?
It's lifting weight. So, yeah.
So you're going from out of here.
Sagittal, frontal, but you're kind of transverse. Yeah, because we don't
Yeah,
have
vertical axis.
I'm like, I have to sit through
Yeah.
the test courses and
Yeah.
you're like,
It helps us more actually to determine what axis your weight is when you're opposite. Because the plane knows it can't get without full all the way.
right?
Yes.
Transverse from,
Yeah, if I was to imagine like a actual axis.
and then it's like
much easier.
rotating around.
Yeah.
Hey, Jen.
Yeah. Did you get it?
Which would be frontal, yeah, it's gonna be on your frontal.
You can use that, so they'll type one.
Should you set one? No,
So we have the shoulder joint is doing horizontal abduction.
What is it
So
most?
the shoulder horizontal abduction
No,
means
no,
the
backwards,
scapula
it's
is
going
adduction.
around.
Okay, yeah, so it's retraction
Around
into
into
the
the
scapula.
Yeah, that, yeah.
Come and get my rotating.
So the scapula is adducting.
Just wrap it around your ribcage.
Wow, that makes sense. And so then three muscles, there's three of them planes. Yeah.
Very good. Very good. Shoulder is it?
I have a question for you on
Yeah.
on one of the first ones. So for the shoulder joint extension, is the scapula doing the
Abduction, and then I just put retraction.
retraction abducting the elbow? Is that what it is?
I think there's a slight amount of elevation. in
Frontal,
this
right?
position. So as you pull back, the scapular is gonna come down a
No.
little bit
Wait, I think it's
and
the same.
rotate.
Is if it's straight out, would it be retraction too?
Well, that's usually.
Retraction is part of downward rotation.
No, I'm trying to imagine an axis.
Yeah.
That makes more sense. I was like,
So it
Going
rotates
from
down and
here.
because I remember, so
Like a
in high school, like, sagittal axis, like, time, because your shoulder and scapula, that would be doing
that is
No,
retraction.
Okay.
Because it's free, so the actual scapula itself, I think. Cause it's just, cause if it's retracting,
Remember how
would it just be
so
retracting
intimidated by
on the
this
frontal?
my
Is
first
the scapula
semester
axis
in
this
105?
way, or is it this way?
Because we went through it really fast.
Because sagittal movement is on the
By the end of the
frontal
semester, you won't
axis,
even need to.
and so then the frontal plane is on the
I had
sagittal
everything
axis.
down.
Yeah, so I think it would be frontal.
I think,
Because I can't see it
Cause it's
going
not,
around
cause
the
that
frontal
actual,
axis.
cause your actual scapula
I
is.
promise by the end of the semester, you probably.
Like they're both like right next to each other, so I can't see it going around a different axis, you know, like the axis activity.
I think you're right. It's hard cause like your actual shoulder like up here, kind of like rotates a little bit, but then it's, the scapula itself is just moving back and
Yeah,
forth.
they're pretty stable.
Yeah, I mean, frontal rotation.
It's not that I'm very confused.
Together, which is.
He said it was transverse.
What one? I don't know this one, just.
I guess it does kind of, it is,
Sure.
cause it's like, if you think of like, if your
Ready to
rib cage
get
is
back
kind of
together?
rounded,
Check
it's
in?
rounding around you.
So it seemed like everybody had,
Okay, yeah, no, that makes sense.
Cause if it's rounded, it's kind of.
'Cause it's like
Everybody
kinda
had horizontal
curving.
abduction?
Yeah, gotcha, okay, no, that makes sense.
so I forgot the first question. First question is lifting or lowering?
Lifting.
Yeah, so that's the part of where you're lifting, so the plates would be coming up. So opposing gravity is lifting, right? So concentric and concentric, there are 5 horizontal abductors. So what are they? Got two of the rotator cuff, which would be infraspinatus and teres minor. What else? What part of the deltoid? Yeah, middle fibers. Do the lats help out a lot? Is there lats somewhere in there? Okay, what else have we got? Yes. Del posterior, infraspinatus, teres minor. Yeah, middle fibers of the deltoid, and latissimus dorsi. Are those the 5 in there? Yeah, okay. So plane. So we're going around, which is what? Yeah, transverse. So around the body. So it's not quite the same as doing, what plane would this be? This type of thing.
Frontal.
That's frontal. What's this?
Sagittal.
Sagittal. So then around is transverse. Yeah. So transverse plane, longitudinal or vertical axis. So scapula. What's the scapula doing? Yeah, adducting or retracting. You can really get a sense, especially towards the end point. So concentric, and then retractors are 2 parts of the trapezius and rhomboids. Now, on the plane, remember, scapula for retraction and protraction is just gliding around the rib cage. So gliding inward around the rib cage. It's not doing this or this or this or this or tilting. It's around. So it's a transverse plane longitudinal axis for the scapula as well. So very good. So you've done your first movement analysis. So this is something that we will talk about repeatedly. Almost every single class period, bringing in a brand new movement analysis. So pretty soon, you just kind of know the joint actions. You don't need to look very much to identify muscles, and things go pretty well. So make sure you keep this, because you'll use this for the whole semester. One thing I need you to do though, put your name on your movement analysis and hand it up, and that way I can put it in the grade book, and then I'll give it back. So the one thing I don't like about this textbook is they save movement analysis to the very end. And I would rather just,
Because that was the elevating the opening. So it was up and
Right.
okay,
and then if
that's,
you were like
what we can do
doing the
is work on
first
this after
movement,
class.
it would be like over here.
Do I have everyone's?
Rotation. It looks like.
Okay.
I'm just making it actual application of it, not just memorizing.
That's application, that's what it's all about.
So much easier.
Which is weird because in high school I used to be like, come on, just go memorize stuff and then not.
So as you're going out into the real world and getting jobs, it's not gonna do any good to memorize a bunch of words if you really don't understand the application.
Oh, this all is making sense.
Okay. So let's finish up with chapter 1. We talked about joint actions and skeletal system and unique features of bone. So let's talk about all the minute adjustments that take place within a joint to enable large movements. So physiological versus accessory motions. Osteokinematic motions are motions that we just studied. So looking at flexion, extension, abduction, adduction, rotation, all those things that we've been talking about through chapter 1. In order for those osteokinematic motions to occur, we have to have movements taking place between the articular surfaces of bone. So the parts of bone that articulate to form a joint, we have to have minute adjustments that allow for these larger movements to take place. So we call those arthrokinematic or accessory motions. Arthrokinematic or accessory motions. So there are three. This is good test material. So what are the three arthrokinematic motions? And so we have spin, roll, and glide. Spin, roll, and glide. Do you remember how we talked about how the knee joint is not a pure hinge joint? That it has a little bit of rotation? That would be an arthrokinematic motion. So the rotation that we talk about between the femur and tibia as the knee flexes and extends would be this spinning type action. So the tibia spins relative to the femur as we flex and extend the knee joint. The other ones we have roll and glide. So if we don't have accessory motions, then the osteokinematic motions can't occur to any substantial degree. So these are very important motions that take place. So it's the cartilage. What kind of cartilage is present on the ends of long bones? Yeah, hyaline or articular cartilage. It's that cartilage that allows for this smooth interaction during these accessory motions. So we have to have these accessory motions in order for the larger motions. So let's take it as an example. So you're all in a seated position. So when you stand from a seated position, you have a little bit of spin and a little bit of glide. Rolling is present in there too. So we have all three of these accessory motions. When standing, so your knee joints are flexed, right? And then, so as you're standing, what changes at the knee joint? The knee joint goes from flexion in a seated position to extension in a standing position. So this represents the tibia, this represents the femur, and so the femur rolls forward, but what else do we also have to have? If the femur rolls forward, it also has to slide back, doesn't it? Yeah, it can't just roll forward because it has nowhere to articulate. So in order to come to a rest on the top of the tibia, it also has to slide back. And then we also get a little bit of spinning action too. So the femur spins internally, the tibia spins externally. So we have this spin action as the femur rolls forward and slides back on the tibia. So how are we able to do this all at once? Well, we have ligaments. So you can see there, just barely, you can see the anterior cruciate ligament peeking out right there, and the posterior cruciate ligament that stabilize the knee joint as it undergoes these accessory motions. So the same thing can occur as we go from an extended position to a flexed position. As we go to a flexed position, the femur rolls back, slides forward, and spins externally. So it's exactly the opposite. So the important thing to remember is that to enable these larger movements like we use for movement analysis, we also have smaller movements that are taking place between the articulating bones, is the take-home message. Okay, so any questions on chapter 1 before we go to chapter 2? Okay, all right, so let's go into chapter 2 then. And let's talk about neuromuscular fundamentals. So to move effectively, we have to have muscles, we have to have nerves that control the muscles, and we have to have a skeleton that provides attachment points for the muscles. So let's talk about skeletal muscles to start with. Skeletal muscle is different than cardiac muscle and smooth muscle, but has some features in common. Skeletal muscle exhibits fatigue resistance, very similar to cardiac muscle. The cells are similar in some ways, but also unique as well. So skeletal muscle is responsible for movement due to its attachment to the skeleton through tendons. Okay, functions of skeletal muscle provides protection. So protecting our vital organs, provides some additional padding to the body. Dynamic stability of joints. So we have dynamic. What's the opposite of dynamic? Static. So muscles provide stability to joints that aren't moving, but muscles also provide stability to joints as they move. So the rotator cuff represents a great example of providing dynamic stability to the shoulder joint. So as the shoulder joint is moving, the rotator cuff muscles activate to keep the humeral head in line with the glenoid fossa of the scapula. So we can see the rotator cuff tendon here. It's collectively made up of 4 muscles, and most commonly, if in cases of impingement syndrome, it involves the tendon of the supraspinatus. So you can see here the supraspinatus has its location on top and runs just underneath this acromion process. This is the acromion process of the scapula. This is the clavicle. And so the supraspinatus runs just underneath and has its insertion on top of the humeral head, just underneath the clavicle. So this is why it's so important that we have proper rotation of the scapula, because in order to abduct your shoulder joint or to flex your shoulder joint, the scapula has to rotate to allow the humeral head to abduct or flex. Otherwise, if the scapula doesn't rotate, if this acromion doesn't move, then we get this friction and impingement, this pinching of the supraspinatus tendon underneath the acromion. We don't have very much room there, and it's different for different people. There are 3 different shapes of acromion. We could say the acromion process can be 3 different shapes. So some people have less room and they're more prone to impingement. Other people have a little bit more room. Generally, there's about 10 millimeters of space underneath the acromion, between the undersurface of acromion and the supraspinatus tendon. 10 millimeters, that's not very much. And so we have to have that rotation of the scapula to avoid impingement of these tendons. So we have the subscapularis in the front, and then what's not pictured are the 2 posterior muscles of the rotator cuff. So the infraspinatus and teres minor. But the whole point of this is that the rotator cuff provides this dynamic stability. Contribute to posture and support. So we did the first half of the FMS this week, and we looked at posture. We looked at alignment. And alignment was a big part of your score, wasn't it? Okay, so being able to have good posture in a static position as well as when we move, that's very important. Produce a major portion of total body heat. So muscles help maintain body temperature as the environmental temperature gets cooler. As much as 70% of body heat is produced by muscle tissue. Lots of skeletal muscles in the body. You'll learn however many are in this handout, which is the major ones emphasized in your textbook. So we focus on the ones that are larger, that produce lots of force. We don't focus on the tiny muscles that are involved with swallowing or with eye movement and so on. So the larger muscles. There are 215 pairs of skeletal muscles that have opposing actions. So we call them antagonists because they have opposing actions. So can you identify some? Some of the more easier. Yeah, bicep, tricep, and that's always the first example. It's very easy. The biceps does what? Flexes. The triceps does what? Extends. So remember I said your brain is the ultimate multitasker. So in order for your biceps to flex the elbow joint, what has to happen with the triceps? Has to relax. So how well does your bicep flex the elbow joint if the triceps is contracted? Not very well. So ideally, we want the triceps to be inhibited, and that inhibition takes place in the spinal cord, which allows the biceps to perform its action, the desired action of flexing the elbow joint. Any other examples? Yeah. Quadriceps and hamstrings. So the hamstrings, the biceps of the legs. Okay. In fact, we have a muscle down there. The biceps, not the biceps brachii, which is up here. Biceps femoris is down here on the lateral side, and then we have two other semitendinosus and semimembranosus down here as well. So, generally speaking, there is a ratio in quadricep to hamstring strength. So the quadriceps have 4 muscles, hamstrings have 3. Generally speaking, we want the hamstrings to be about 60% as strong as the quadriceps. So the quadriceps, they want to extend the knee joint. What do the hamstrings want to do? Flex the knee joint. What if you have really strong quadriceps and very weak hamstrings? That's like a car with no brakes. Is that a dangerous scenario? Yeah. Okay. So your car has an accelerator but no brake. What are we at risk of if our quadriceps are really strong and our hamstrings are really weak? Think of the hamstrings as the brakes, and the quadriceps are the accelerator. You're at risk of doing what? Hyperextending, which is going to tear that ACL, right? Okay, so one of the factors that goes into rehab for an ACL is strengthening the hamstrings because that's the brakes. So that keeps the quadriceps in check so that we have less risk of hyperextending. So generally we want the hamstrings to be about 60% as strong as the quadriceps. So aggregate muscle action just refers to this process where muscles work together. So rarely do we have movements that involve just a single muscle. Even when we intend to maybe quote unquote isolate a muscle, there's still lots of other muscles working in different roles. So muscles can have lots of roles, and it's really hard just to have isolated action of just a single muscle. Okay, so here's all the superficial skeletal muscles. You'll want to commit these to memory. So a lot of the ones that are really involved with posture and movement and high levels of force are located more superficially, so closer to the surface of the skin. So skeletal muscle as a whole can have different fiber arrangements. So the 2 fiber arrangements are parallel and pennate. It's important to understand that no single muscle is purely parallel or purely pennate. So, excuse me, even muscles that we classify as parallel have just a little bit of pennation, and vice versa. Muscles that we might classify as pennate can have characteristics consistent with a parallel arrangement. So the further you get in your education, I hope you're understanding that almost everything is relative. We have very few examples where in the body where something is absolute and always that way. So we classify things based on what are they mostly. Same thing with muscles. Parallel muscles. Fibers are arranged in parallel, the length of a tendon. So I like an analogy. So muscles, a whole muscle is like a box of spaghetti. A whole muscle is like a box of uncooked spaghetti, and each of those uncooked spaghetti noodles represents a muscle cell. So I could take a handful of uncooked spaghetti noodles from that box, and that would represent what we call a fascicle, a bundle of muscle cells or muscle fibers, a handful of uncooked spaghetti, where we have a bundle of these muscle fibers that are together. And so you take a bunch of bundles and wrap those together, and that's what a whole muscle is. So parallel muscles have fibers, think of uncooked spaghetti noodles, fibers that are arranged parallel to the length of the muscle. It's also important to understand that we don't have any examples in the body where a fiber runs all the way from one attachment point to the other. Okay, so the longest muscle in the body is, anybody know? Sartorius. Sartorius. I wanted to name my son that, but my wife wouldn't let me. Wouldn't that be awesome? Sartorius. Can you just see? You got to be jacked if your name is Sartorius. So Sartorius runs from up here all the way down here. Okay? So the Sartorius is a great example of a parallel muscle, but we don't have muscle fibers from the Sartorius that run all the way from up here all the way down here. So the longest muscle fibers are about 10 inches. So we have some fibers that may run quite a ways, but then they end, and then we have other fibers that take over and run the rest of the length. So muscle fibers don't run all the way from one attachment to the other. So stepping back, what's the practical application of this? How good will our strength training results be if we're only using a partial range of motion? Not very good, because fibers don't run all the way from one attachment to the other. So that's another plug for full range of motion training. So if we're using an amount of weight that we can't lift the full range of motion, we probably need to lower the weight until we're able to get that full range of motion, because that trains all the fibers that are involved between attachment points. Okay, so examples of parallel muscles. Let's take a look here. So a few different examples. So flat, fusiform, strap, radiate, sphincter, or circular. So all those different classifications. Let's go over some examples of each. So these are all examples of parallel muscles. So a flat parallel muscle, a good example would be the rectus abdominis and external oblique abdominis. So the word rectus literally means straight line. So the rectus abdominis has fibers that run from the bottom of your rib cage all the way down to the pubic crest. And so it is separated by these tendinous inscriptions. These flat muscles also tend to have internal tendons. So we think of, sometimes we might think of tendons as these rope-like structures, and that is true, but we also have tendons that are more sheet-like. Fiber sheet-like, we call them aponeuroses. So it's more like a sheet that can be inside a muscle itself. And so sometimes muscles don't connect directly from bone to bone. Sometimes muscles connect to each other. So it's almost like the muscles in the body are like a highway system. So muscles are not only connected to the skeleton, but they're also connected to each other. So that goes right along with this concept of the kinetic chain, right? So force production from the legs is going to be passed on to where? Right here, the core, okay? And then from the core, where? Up here, right? So like a highway, force production begins as we push into the ground. What does the ground do? The ground pushes back. We apply force into the ground pushes back. That force comes up the lower extremities across the core and into the upper extremities. So force moves along muscle lines a lot like a highway system. So these aponeuroses allow muscles to connect, not just to bone, but to each other. Okay, so fusiform, another type of parallel muscle. Fusiform, sometimes called spindle-shaped. So, great example, brachialis and biceps brachii. So the brachialis is another elbow flexor, sometimes called the true elbow flexor because that's all it does. Whereas the biceps has some actions at the shoulder joint and radial ulnar joint. But you have these tendons that taper at each end. So it kind of looks like a spindle with the fleshy portion of the muscle in the middle. Okay, strap muscles. This is where we get to that sartorius again. So longest skeletal muscle. And so it has its origin up here, you can see, its attachment point up here, as we talked about, the anterior superior iliac spine, running all the way down across the leg to attach down here at the medial condyle of the tibia. So it's a very long strap type muscle, kind of looks like a belt, fibers running in parallel to each other. Okay. So radiate muscles, kind of a combination of flat and fusiform. So you have the fusiform, this spindle type shape, but then you also have the flatter surface as well. So each side has an attachment point to the skeleton. So the pectoralis major. So what part of the pectoralis major would represent the flat part, flat arrangement? So the pec major attaches right here to the sternum. And so I'll just answer my own question. That's the part that would represent the flat arrangement. Right here, all along, all the way up the sternum here. And then the fibers of the pec major taper down to a single tendon that attaches over here at the humerus. So the pec major is an example of this radiate type arrangement. Lastly, we have sphincter or circular muscle. We don't study those too much, but orbicularis oculi, okay, open and close your eyes. Okay, orbicularis oris is open and close your mouth. So we don't pay too much attention in this class to those muscles. Okay, pennate. So with pennate muscles, the advantage is force production. So I'll ask you on the first exam, I'll say, what is the advantage of parallel muscles? You'll say the advantage is range of motion. So they're able to shorten over a long range of motion. That's the advantage of parallel. And the next question will be, what's the advantage of pennate muscles? And you'll say force production because we have lots of muscle fibers in a given area. So they have a greater cross-sectional area, more contractile tissue in a given area. Now, having said that, no muscle is purely one or the other. So we look at things as mostly this or mostly that. Okay, so they're categorized by fibers that run at an angle to the tendon. So this kind of look like a feather type arrangement. That's kind of comparable. So unipennate, which means how many? One. Bipennate, two. So one, two. Multipennate is lots. So we talked about aponeuroses. Aponeuroses are internal tendons. Can you see in this picture how we have these internal tendons that are depicted? Fibers running in all different directions. Okay, so unipennate muscles. Fibers run obliquely from one side only. One side only. So you have the tendon, and then fibers that are attached at an angle there. So the biceps femoris, just the short head. So the biceps femoris, lateral part of the thigh, has two parts, long head and a short head. The short head is a unipennate. Extensor digitorum longus. So if you had to guess, where do you think that muscle would be? The fingers. Why? Digits. And what does it do with the fingers, do you think? Extends the digits. Extensor of the digits. And usually where there's a longus, there's also a brevis. So there is an extensor digitorum brevis, but this is an extensor of the digits. So you can extend your fingers like this, and you can see those tendons that run down into your fingers. If you really extend, that's from the extensor digitorum muscle. Tibialis posterior. So that's in the deep compartment of the lower leg that assists with plantar flexion. So just a few examples. I would be prepared to know one example of each. One example of each would be a good idea. So just memorize one example of each.
Muscle.
Mm-hmm. Yeah, so what's a unipennate example? That would be a test question. Bipennate. Classic example, we have this nice rectus femoris right here. Right down the middle of the quadriceps, that rectus femoris. We have the vastus intermedius underneath the rectus femoris, so we can't see it. But the other two quadricep muscles, what's this one on the medial side? Vastus medialis oblique. Sometimes the oblique is added in there. What's this one on the lateral side? Vastus lateralis, yeah. Good, so there's this tendon, and then you have fibers that converge on each side. Okay, multipennate. Love multipennate muscles because there's lots of different fibers that are oriented in all sorts of directions. So the deltoid is a great example where you've got these internal tendons. What's the formal term for internal tendons? Aponeuroses. Aponeuroses, these internal tendons. So the deltoid has fibers that run in lots of different directions. Think of how many actions, Corey's done some shoulder rehab, think of how many actions you did with that rubber band. You're training all of these fibers because the shoulder is capable of lots of different actions. So to fully develop the shoulder, we want to do lots of different actions in various planes of movement and so on. Okay, so muscle tissue property. How are we doing on time? 1:30. Okay, let's do one more slide and we'll stop. So skeletal muscle tissue has 4 properties related to its ability to produce force. So there's four things you need to know about skeletal muscles. So irritability or excitability, contractility. So skeletal muscle cells are unique from other cells in the body because they have these special proteins that connect together to create tension or force. Extensibility. So muscles can stretch. So if we stretch muscles over time, do they increase in their extensibility? Yeah, so skeletal muscle is highly adaptable. So these properties can be trained. We can train a muscle to contract with more force. We can train a muscle to be more extensible. Elasticity. Can a muscle be trained to be more elastic? Yeah. With practice, we can make a muscle develop greater spring qualities. So muscles are great at storing energy and releasing energy. So all 4 of these properties are trainable. We can alter the excitability of a muscle. So we're able to exert force with greater speed. So that'd be very important for athletics, but even for everybody as a whole. I mean, wintertime, you're walking across campus and you have that wind blowing in your face and you're walking across ice and you slip. Okay? Our muscles have to react quickly to restore our balance. So all 4 of these properties are important, no matter if you're an athlete or just an everyday person. So we can train these 4 things and we can get better. So I'd like to, let's stop right there. We'll talk about each of these 4 characteristics as we come back on Monday. So we'll continue with chapter 2, probably do another movement analysis, then I'll give your other paperwork back. Is there any questions? Okay. Yes?
What did you say the advantage of the parallel muscles were again? I've got it.
Range of motion. Range of motion for parallel. Any other questions?
Does that go with flexibility as well?
I would say so. Yeah, so certain muscles would have a greater propensity to respond well to flexibility training based on their arrangement. Yeah. Okay, thank you.